Good afternoon. Welcome to the workshop, Blood Glucose After Transplant, Why It Matters. My name is Marla, and I will be your moderator for this workshop. It is my pleasure to introduce today's speaker, Dr. Emily Gallagher. Dr. Gallagher is a board-certified physician in internal medicine and endocrinology, diabetes, and metabolism at Mount Sinai Hospital in New York. Her clinical practice, she sees firsthand how diabetes may contribute to specific symptoms and illness in people who have received a stem cell transplant or CAR T-cell therapy. She also treats patients who have no history of diabetes but who develop high glucose levels when diagnosed with graft versus host disease. Please join me in welcoming Dr. Emily Gallagher.
Thank you, Marla, and thank you for the BMT Infonet group for inviting me to present today. So I'm going to present on blood glucose after transplant and why it matters. So the learning objectives from today's presentation are to hopefully help you understand what normal blood glucose levels are, what the health consequences are of having blood glucose levels that are either too high or too low, how a stem cell transplant can affect blood glucose levels, and then steps stem cell transplant recipients and their healthcare providers can take to detect and manage blood glucose levels. So first of all, what is glucose? So glucose is a type of sugar that is commonly found in food, and our bodies make glucose from carbohydrates. So if you look at the nutritional label here as an example on the right-hand side, that you can frequently find on many food items, you can see that the main food categories are total carbohydrates, which is the glucose or sugar in your food. It can also be made up partly of dietary fiber. And then the other two major constituents of nutrition in food are fat and then also protein. So why do we need glucose? So when we eat food that contains carbohydrate, our body breaks it down to form glucose, or what we often call as sugar. This causes the glucose levels in our bloodstream to increase, which is shown in the schematic here. And then this is important because it provides energy to our organs, such as our brain for thinking, and also our muscles so we can do activities. So we also store this glucose in our liver. So when you're fasting, you don't want your blood sugar to drop too low. And so when you're fasting, your liver puts out a little bit of glucose in order to keep your blood glucose levels normal. So how do we keep our blood glucose levels normal? So as I said, when we eat, our blood glucose levels increase. And this is regulated then by our pancreas, which makes insulin. So the insulin then actually helps our bodies take the glucose from our circulation or our bloodstream into our muscles and into our fat so that we can actually use the glucose for energy. And then the blood glucose levels will come back down again and return to normal as the insulin from our pancreas causes the glucose to go into these tissues such as muscle and fat. So what makes blood sugar go too high is then if we do not make enough insulin. So some people, their pancreas doesn't work properly and they can't make enough insulin to bring down the blood glucose, or they can make insulin, but for some reason, such as sometimes certain medications, we can be making insulin, but the body doesn't respond normally to the insulin that we make, and so our blood glucose levels don't come down when we make insulin. And this is what causes blood glucose levels to be high, and this is what we commonly refer to as diabetes. So how common is it to have a high blood glucose or to have diabetes? So this is a picture of the world, obviously, and this is from the International Diabetes Federation 2021 Diabetes Atlas, essentially showing the rates of diabetes across different countries in the world. And so you can see that there are some countries, the darkest colors here, where more than 12% of the population have diabetes. So this is, if you think about it in another way, this is 1 in every 8 people or so has diabetes. And then in other countries, like the pink ones here, it's closer to 1 in every 10 people. So considering the prevalence of diabetes, this is very common. So diabetes is essentially a very common disease that you can think of as affecting 1 in 10 or more than that in different populations. So diabetes also becomes more common as we get older. And so in this picture here, you can just see the rates of diabetes as people age. So on the left-hand side is people aged 20 to 24 years of age, and then on the right-hand side, it's age 75 since 79. And you can see in different countries, so in high-income countries, middle-income countries, and low-income countries, the prevalence of diabetes goes up as we get older. So what happens then if blood glucose levels go too high? So if your blood glucose is too high, you can get some short-term consequences, and then there are long-term consequences. So the symptoms of having a high blood sugar in the short term, it tends to cause people to urinate more frequently. And this is because if your blood glucose is too high, the only way your body can get rid of that glucose is in the urine. And this causes people to become dehydrated as they urinate more to get rid of the glucose from their bodies, and this draws out the water as well. And this can cause people to become dehydrated or feel thirsty, and so there's an increase in thirst. Surprisingly enough, people can actually have an increase in appetite when their blood glucose is too high. And this is because, as I said, the glucose should be going into this muscle to give you energy, but your body actually can't get the glucose to where it should be. And so even though your blood glucose is high, people frequently feel hungry and actually are craving sugary food sometimes because their bodies think that they don't have enough glucose. And so sometimes you can actually get an increase in appetite. People then often lose weight, and so this is a problem that we frequently see when people have high blood sugar, in that they're eating and they're taking in calories, but again, the glucose is getting wasted in the urine, and so they're actually losing all those calories in their urine. And so when the blood glucose is high, they can actually lose weight, and it can be very difficult for people to regain weight when they have very high blood sugar because, as I said, they're losing the calories that they're taking in. Another thing that can happen is that people can get blurry vision, and this is very under-recognized, that people don't recognize that their vision is blurry because their blood sugar is high. And so this is because the lens in the eye can actually get dehydrated too. Basically, it can change the vision. When the blood sugar comes back down to normal again, people's vision goes back to what it was after a few weeks. People can feel tired, and this is again because the glucose that you're taking in your diet is in the blood, and it's not getting into the muscles and the tissues that you're supposed to be going to, and so this can cause people to feel very tired and lack energy. And then eventually, if the blood sugar is very high for a period of time, people can get very dehydrated, and this can cause a change in some of the salts and the electrolytes in the bloodstream. And this can actually eventually affect the brain, and people can become confused. And in its most serious forms, people can actually become comatose because of very high blood sugars. This happens after. So all of the symptoms, usually the urination and the thirst come first. The weight loss is after that, and then if it goes on for a very long time, then people develop the confusion and the coma. Long-term, then, diabetes can have other consequences. So if somebody has had diabetes for 10 or 20 years, they can end up with, if it's uncontrolled, they can end up with changes to the back of the eye, and this can cause loss of vision, and diabetes is one of the most common causes of vision loss. It can also damage the kidneys. So again, when the blood sugar is high, over time the glucose can cause damage to the kidneys, and this is a common cause of people ending up with kidney failure. It can also damage the nerves. So when people, specifically after bone marrow transplant, a lot of people can actually have had chemotherapy, which can cause damage to the nerves. And if people also have high blood sugar or diabetes, this can worsen. And so numbness in the feet can be a problem with long-standing diabetes. It's important because when people have numbness in their feet, if they get an infection or an ingrowing toenail, they sometimes don't feel any pain from the infection in the foot. And this can lead it to become uncontrolled, and the infection can sometimes get quite deep, and then people can end up with serious infections in the bones of their feet on occasions, or non-healing ulcers in the feet. And then long-term, we also can get circulation problems related to the high blood sugar, and this can affect the heart. So people can end up with narrowing of the arteries in their heart. It can affect the brain, where people can sometimes have a stroke from long-standing diabetes. And again, the circulation to the legs can be affected by diabetes, which can cause pain or cramps in the legs when people try to exercise or walk. And it can also end up with poor circulation, so poor healing in the feet if somebody was to, again, get an infection. So specifically in stem cell transplant recipients, there are other consequences of having high blood sugar. So sometimes the high blood sugar can cause somebody to stay in hospital for a longer period of time. And this is because the glucose needs to be under control, sometimes for the person to be able to be discharged home. It can also lead to an increase in graft versus host disease. So there are some studies that show that people who have high blood sugar or diabetes are more likely to get graft versus host disease. As I mentioned, it can cause some kidney damage, partly related to the dehydration from the diabetes and also related to the high blood sugar. And then people can actually are more likely to get infections if they have uncontrolled high blood glucose levels. Along with all the complications that people can get from diabetes and high blood glucose, and especially in the setting of stem cell transplants, it can actually reduce life expectancy and it can reduce quality of life related to some of the complications. So the long-term risks of heart disease, I'm not going to get into in great detail. Dr. Fradley tomorrow at 11 a.m. will be discussing the long-term consequences on heart health related to stem cell transplants. But essentially, there are a number of individual factors, such as this person's age, their sex, their race and ethnicity, and their family history of cardiovascular disease that can increase their risk. And diabetes plays into all of these factors that can actually lead to accelerated heart disease. So the treatment factors related to the stem cell transplant, including chemotherapy and sometimes radiation, can increase the risk of somebody developing cardiovascular disease. The stem cell transplant itself and the conditioning treatment for the stem cell transplant can also increase the risk. And then the graft versus host disease, which is a type of inflammation, if you think about it, it can also be combined to increase heart disease. And diabetes, on top of all of these factors, can also increase the risk of developing cardiovascular disease. So there is another myth that's out there that people think that glucose itself can actually cause cancer. And so why is this kind of propagated and why do people believe this? So there are some cancer cells that actually take up glucose. So if you ever go for a PET scan or a PET CT scan, the injection they give is a type of glucose, and this tends to go to very metabolically active cells, and the metabolically active cells are ones that take up glucose, and some of these are cancer cells. But as we know, we also have to use the glucose for our skeletal muscles and in order to get energy. And so when people go for this test, they fast specifically so that the glucose doesn't go to their muscles and instead can be taken up by the tumor cells. The second thing is that people with diabetes do have a higher risk of developing certain types of cancer. So for example, with multiple myeloma, there are studies that show that people who have diabetes have a greater risk of developing these cancers. However, there's no evidence that actually the glucose in our diet causes these cancers. And so this is a very different thing. And so it is important that we do have a certain amount of carbohydrate or glucose in our diet in order to give our bodies the energies that they need. And so there's a lot of confusion that happens here basically related to the links between glucose and cancer. But it's important that we don't starve ourselves of glucose because we do need the nutrition, especially to recover from stem cell transplants. So then how can the stem cell transplant itself increase the blood glucose levels? So the conditioning treatment before a stem cell transplant has been associated with increased blood glucose levels. The stress of the stem cell transplant itself can increase glucose levels. Sometimes after stem cell transplants, people aren't actually able to eat or take in nutrition. Sometimes if people have complications from the transplant, they require intravenous nutrition. And the intravenous nutrition tends to have contain both lipids or fat as well as protein and carbohydrate, and sometimes the glucose or the carbohydrate in the parenteral nutrition can increase glucose levels. And so often people will end up with insulin in the parenteral nutrition as well to control the blood glucose levels. So the immunosuppressive treatments then that are given after a stem cell transplant include glucocorticoids or steroids, and then the immunosuppressives such as tacrolimus and cyclosporin and sirolimus can all increase glucose levels. And then the inflammation after the stem cell transplant. So inflammation can come in a variety of ways. One can be infection. So infection can sometimes increase and sometimes decrease the blood glucose levels. The graft versus host disease is a type of inflammation in the body that can cause glucose levels to go up. And then again, the steroids that are used to treat these conditions can also increase glucose levels. So these factors can either reduce insulin production. So as I mentioned in the earlier slide, the way that our bodies usually control glucose is to increase insulin production from the pancreas. But if we're not able to increase the insulin production from our pancreas, or if one of these treatments affects the insulin secretion, then basically glucose levels will increase. The second way that they can affect blood glucose levels is that they can reduce our body's response to insulin. So we can't reduce the glucose levels as we normally would because these medications or these treatments can sometimes interfere with how our body responds to insulin. And so both of these things can then lead to blood glucose levels going up. So the other factors that increase the risk of us developing high glucose levels are age. So as I showed you in the earlier slide, the older we are, the more likely we are to develop diabetes. If we have a family history of diabetes, so if we have particularly a first-degree relative, such as a parent, a sister, or brother with diabetes, then that increases our risk of developing diabetes. certain racial and ethnic groups are at higher risk of diabetes. And then being overweight or obese, as measured by body mass index, can increase the risk of developing diabetes. If you ever had diabetes during pregnancy, it increases the risk of developing diabetes down the road. People who had a history of polycystic ovarian syndrome can also have a higher risk of developing diabetes. People who have HIV or on medical treatments for HIV, it also increases the risk of developing metabolic diseases such as diabetes. And then physical inactivity can also increase the risk of developing high glucose, because normally when we're active, we use the glucose in our muscles, again, whether we're walking around or doing more rigorous activity. And therefore, if we're not active and not moving around, then we're not using up as much glucose, and this can increase the glucose levels. So I mentioned body mass index, or BMI. So what is that exactly? So what we do when we see patients is to measure their body mass index, and it gives us an idea of whether they're a healthy weight, or whether they're overweight or underweight. And so what we do is we measure somebody's height, which is, for the purposes of the calculation, measured in meters, and we measure their weight in kilograms. And then there are online calculators that we use, or that you can use, in order to calculate your body mass index. So what is the body mass index then, and what do the numbers mean? So if the body mass index is calculated as less than 18.5, it means that we're underweight. A normal weight body mass index is considered between 18.5 and 24.9. It's considered overweight if the body mass index is between 25 and 29.9. And then what's considered obesity is a body mass index of 30 or greater. So as I mentioned, a body mass index in the overweight or obese range increases our risk of certain conditions, and one of these is diabetes. So there are some very important caveats to body mass index. So it's not a perfect measure. So the BMI ranges are different in different racial and ethnic groups. So for example, in Asian Pacific regions, the numbers are different, and this is because people can develop metabolic diseases at lower BMI levels. And so here, overweight is actually considered 23 to 24.9, and obesity as a body mass index of greater than or equal to 25. There are also some other important caveats. So as I said, it can have a higher risk of developing diabetes if you have a higher BMI, but there are many people who have normal body mass indexes who can also have high glucose levels. And so although it does increase the risk by having an overweight or obese body mass index, there are plenty of people, especially after stem cell transplants, that due to other reasons can have high glucose levels even if their body weight is normal. The waist circumference then is a different measure. So sometimes if you think about somebody's body mass index, you can have two people who have exactly the same body mass index, but their weight distribution is very different. So some people can have weight around their thighs and their hips, which is considered sometimes more metabolically healthy than somebody who can have the same weight, but the weight is distributed more around their stomach. And so it's possible that the body mass index cutoffs are imperfect in certain racial and ethnic groups, and in addition to people who are getting treated for stem cell transplants, and then also people who have different body weight distributions. Then how can we tell if we have high glucose levels? So one thing is that I always tell people about the symptoms of high glucose levels, and so this is important to recognize because oftentimes people don't realize why they're losing weight. They don't realize why their vision's blurry, and they don't know why they're thirsty all the time. And so recognizing the symptoms of high glucose is one thing that's very important. The second thing is that you can get blood tests done to check if your glucose is high. And actually, if you regularly get blood tests done, you may not realize, but the glucose is done in almost all routine lab tests. So what are then considered normal and high blood glucose levels? So there are different criteria used to define high glucose, and this is from the American Diabetes Association 2023 guidelines. So depending on which country you're in, the measures are slightly different. So in the U.S., milligrams per deciliter, which is the top row here, is the typical measure. In Europe and Canada and other countries, millimoles per liter are typically used. And so the numbers look quite different depending on which measurement you're using. So just to focus on the U.S. one, so normal is considered less than 100 milligrams per deciliter, and this is fasting glucose for at least 8 hours. A borderline or pre-diabetes glucose level is between 100 and 125 milligrams per deciliter, and then greater than or equal to 126 is considered high glucose or diabetes, and this is, again, fasting. So oftentimes people aren't fasting when they come in for blood tests, and they just get blood tests done as part of their random routine measurements. And so in that situation, the glucose levels are going to be different. So one test that we do sometimes is a 2-hour glucose tolerance test, and this is where somebody comes in fasting and we give them a 75 grams of glucose to drink, and then basically measure the blood glucose for the period of 2 hours after the test. And in this situation, if the 2-hour level is less than 140, it's considered normal. Borderline is between 140 and 199, and then a high glucose level is greater than 200. We can also define diabetes based on a hemoglobin A1C, which I'll explain in a little bit more detail on the next slide. But a hemoglobin A1C of less than 5.7 in the US is considered normal. 5.7 to 6.4 is what's considered prediabetes or borderline diabetes. And then a high glucose or diabetes is considered an A1C greater than or equal to 6.5. Again, in Europe, the measurements are slightly different, and so they're measured in millimoles per millimoles per mole for the A1C, and this is the cutoffs here on the bottom are different cutoffs. Now, as I said, so some people don't come in fasting for tests and don't have a glucose tolerance test, but we can still define high glucose. And this is where somebody comes in with a random glucose, and basically meaning that it's any time of day greater than or equal to 200 milligrams per deciliter if they also have the symptoms such as the thirst and the increased urination and the weight loss associated with high glucose levels. So you don't necessarily have to have the glucose tolerance test or a fasting blood glucose to define diabetes. So then what is the hemoglobin A1C? So some people find this confusing because often if you look at your blood tests and you're used to thinking about the bone marrow and your cells, people often confuse hemoglobin A1C with their hemoglobin level. So what is exactly hemoglobin A1C? So when we think about what we're measuring, so basically your red blood cells are made in the bone marrow and they get released into the circulation. And the red blood cells live in the circulation normally as long as there's nothing happening to them for approximately 120 days, which is 3 months. And so your hemoglobin, so your red blood cells contain what's called hemoglobin, which is a molecule that carries oxygen around in the blood. So if you get your complete blood count done, frequently we will get the results of the hemoglobin level, and this is a sign of anemia if it's low, and essentially this is a measure often of red blood cells in the circulation. So the hemoglobin carries around oxygen, so if you're anemic or your red blood cells are low or the hemoglobin level is low, then one major symptom people get is often fatigue because they have a decrease in the ability to carry oxygen around in their blood. However, the hemoglobin also binds to glucose. So when you have high glucose in your blood, essentially this glucose also binds to the hemoglobin, and we use this as an indirect measure of glucose levels over the past 3 months because that's how long the red blood cells or the hemoglobin survives in the circulation. So essentially, as the red blood cells go around in the circulation, over the course of those 3 months, they have the ability to bind to whatever glucose is in the circulation. And then we use this hemoglobin A1C measure as a measure of how high the blood glucose has been. So a caveat to this, again, in people who've had a stem cell transplant, is that if somebody gets a blood transfusion and the red blood cells in their circulation are not theirs, then for that period of time that those red blood cells from a blood transfusion survive, the hemoglobin A1C is going to be inaccurate because the red blood cells basically haven't come from their own glucose being bound to it. So in that situation, you can't rely on the hemoglobin A1C, and we typically will measure the blood glucose levels instead. The second thing is if somebody is bleeding, so if they lose blood for some reason, or if they're not making red blood cells properly from their bone marrow, the hemoglobin A1C measure can also be inaccurate. So what happens then if the blood glucose levels are too low? So we focus mostly on the high blood glucose levels, but people after stem cell transplant can also have low blood glucose levels. And what causes the symptoms of low glucose levels are often that people feel more hungry. Again, and this is because they're missing the nutrients that they need. They can often feel pale and sweaty and cold and clammy. So this is a common symptom of low blood glucose levels. They can often be anxious or irritable, so kind of not acting like themselves, and this is because the glucose levels to their brain are decreased. You can feel like your heart is racing, and then people can feel like a weakness or a tingling. And again, if it's very severe low glucose levels, people can actually become very confused, and they can black out and have seizures and coma. This is obviously a very severe situation if this occurs. So how do you know if the symptoms that you're getting are from a low blood glucose? So sometimes these symptoms can be confusing because people can feel obviously anxious and irritable for other reasons, and sometimes anxiety can cause the heart to race, and it may not be from blood glucose. So the main way to check the glucose levels if somebody's getting these symptoms is to check it with a finger stick glucose meter, and if the level is less than 70 milligrams per deciliter, then this is considered low glucose. So how can people then, after stem cell transplant, develop low blood glucose levels? So this is typically seen in a few different situations. So one is that often after stem cell transplant, people can have been treated with glucocorticoids or corticosteroids for a period of time. If somebody's been on steroids for a long period of time, then the steroids that they're taking as pills actually cause their own cortisol levels to decrease. So because you're getting the cortisol in from the pills, your body doesn't have to make cortisol itself. And so over time, this can actually cause somebody's cortisol levels to become very low. And this can lead to, when the pills get stopped, then this can lead to somebody to have what we call adrenal insufficiency or low cortisol levels. And one of the symptoms of low cortisol levels is low glucose levels. And so this is a very common thing that we see, and it's very important to recognize that when somebody's stopping steroids after having been on them at a very long period of time, they are at risk of having low cortisol levels. The other thing is that sometimes when people are on these steroids and other medications that increase the glucose levels, doctors prescribe them with a lot of glucose-lowering medication. And so it's important then, if the steroids and the other transplant-related medications are getting reduced or stopped over time, that the glucose, somebody's looking at those medications that are being prescribed to lower the blood glucose as well, because they would also need to be decreased or stopped at the same time. When somebody has a loss of appetite or is fasting and also taking blood glucose lowering medications for diabetes, then this can also contribute to low glucose levels. So some of the medications to treat diabetes are pills that increase the amount of insulin that we make in our own bodies. And obviously, if you're not eating and you're making too much insulin, this can drop the glucose levels to become too low. So it's important, again, if you're not eating, to talk to your doctor about, whether you should be taking your diabetes medication or not. And then certain infections can sometimes lead to low glucose levels. So bacteria occasionally like to take up glucose, and this can reduce the glucose levels in the circulation and in the blood, and can be a sign of somebody potentially having an infection. So then how do we treat high blood glucose levels? So it's important that the doctor who's treating you for your blood glucose knows that you had a stem cell transplant, because some of the medications that you're taking after the stem cell transplant may be contributing to blood glucose levels. There's also the potential of having drug interactions related to the stem cell transplant medication and also the glucose lowering medication. And so it's very important that your doctor knows all of the medications that you're taking so that they can choose the right path for you or the right medication to treat the glucose levels. So also tell the doctor helping you to take care of your blood glucose about all of your symptoms. So if you're experiencing a lot of weight loss, or if you have lost a lot of weight, then some of the diabetes medication may not be the right choice for you. And so it's important to talk to your doctor about all the symptoms you're getting as well as all the treatments that you're getting in order to make the right decision. It's also ideal if your oncology or your stem cell transplant doctor can actually communicate with your diabetes doctor, so that if one person is changing a medication, the other person is aware of it in case you develop a side effect, or that the medications can be changed together. So that if you're reducing, for example, the steroids, that the diabetes doctor is aware that this is happening, so that they can also reduce your diabetes medication. So then what are the main things that we do to treat high blood glucose levels? So one thing is lifestyle changes, which we consider nutrition and physical activity. And the nutrition, I'm not going to get into in great detail. There is a talk by Michelle Myers on Thursday about nutrition after stem cell transplant. But essentially, one of the simplest things to do is to avoid concentrated sweets and sugars and have a balanced food intake. And so sometimes all that you need is actually, to reduce a lot of sweets and sugars in the diet, and this can actually help with the glucose control. And sometimes people can do this and actually not even need to take in extra medications or pills in order to regulate their glucose levels. Physical activity, if somebody's able to do some physical activity, even if it's a small amount of activity, it will also help to bring the glucose levels down. So then diabetes medication. So there are a number of diabetes medications that we have. As I mentioned, it's important that your diabetes doctor knows what medication you're getting after the stem cell transplant, if any, because some of these medications haven't been studied in people who previously had a stem cell transplant, and sometimes they can interact with the stem cell transplant therapies. And so it's important to kind of weigh the risks and benefits and for your doctor to be aware of everything that's going on after the stem cell transplant. Sometimes we do treat people with insulin if their blood glucose levels are very high, and this is because it can be easily adjusted. So as long as you understand and your doctor has explained to you how the insulin works, you can often more rapidly control the blood glucose levels with the insulin, and you can also reduce the doses quickly if somebody needs to have the insulin doses reduced. It also doesn't typically cause other side effects, so it doesn't cause issues like diarrhea or stomach upset or anything like that, other than lowering the blood glucose levels. The disadvantage to insulin, obviously, is that it's an injection, and so people often don't like taking the extra injection to lower the glucose levels. Another important thing about insulin is that insulin, while it can be very helpful to control glucose levels, it can work a little too well in that it can lower your blood glucose levels a little too much. There are different types of insulin, so there are long-acting insulin and short-acting insulins, and so it's helpful if you understand the type of insulin that you might be taking so that you can actually work with your doctor to adjust it to control the blood glucose levels as much as possible. And it can be dangerous if, for some reason, you have been started on insulin and you were also, for example, on steroids, and then the steroids got reduced and you're still taking the insulin. This can cause your blood glucose to drop too low, which can be dangerous, and you can develop the symptoms that I mentioned before of low glucose levels. And so it's important that if you're taking insulin, that you are aware and your doctor is aware of what other medications are being changed so that you can also adjust the insulin. So then how do you monitor your blood glucose? So there are a few ways that you can monitor your glucose. One, the most traditional way, is by finger stick monitoring. In people who have neuropathy, like numbness of their fingers or painful neuropathy after previous cancer treatments, this can sometimes be problematic because the finger stick monitoring, you have to prick your finger. Similarly, if people have graft versus host disease that affects the skin and they have dry or cracked skin on their hands, this may not be a practical way of doing it. So fortunately, we do have now these what are called continuous glucose monitors or finger stick-free glucose monitors that people can wear either on their stomach or on the back of their arm. And it allows you to check your blood sugar without actually sticking your finger. And this has been very helpful, I find, in people after stem cell transplants who do have peripheral neuropathy and find it very painful or have difficulty checking their finger sticks. So finally, the last thing I'm just going to discuss is supplements and herbs to treat blood glucose levels. So a lot of people ask me if they can take certain herbs in order to bring down their blood glucose levels. And so I would just have a word of caution with this in people after stem cell transplants. So it is true that many of our currently prescribed medications originally came from natural sources such as herbs, animals, flowers. So metformin, which is a commonly used diabetes medication, actually was originally derived from French lilac, the plant. Other diabetes medication, you might be surprised to know, were actually discovered in the saliva of a reptile and are obviously were modified and made into pharmaceutical products, but essentially this is kind of how the chemical was originally discovered. Cyclosporin originally was discovered in a fungus, and tacrolimus actually originally came from bacteria. So there's a lot of natural sources of the current medications that we do prescribe. However, it's very important to notice that the FDA-approved medications are regulated regarding their dose consistency and quality, while the herbal medications and supplements are not. So it's not guaranteed that the actual dose that you think you're taking is the dose, and they're not regulated in the same way as prescribed medications are. And we do have a lot to learn about medicines, but always make sure to talk to your doctor regarding any safety of any herbs, because you can be surprised that they can sometimes interact. They may have medicinal qualities, but they can actually interact with some of the other therapies that you're taking, including things like herbal teas or supplements that you're considering taking. So I always ask people, before they take anything, just to check in, so we can always make sure that it's a safe supplement for them to take. And so finally, I'm just going to conclude. So high blood glucose levels can cause short-term and long-term issues after transplantation. It's important that you know the symptoms of high blood glucose and low glucose levels, and ask your doctor about the right treatment for you to reduce your risk of the short-term and long-term complications related to high blood glucose. And thank you very much for your time, and I will be very happy to take any questions.
Thank you, Dr. Gallagher, for this excellent presentation. We have a few questions here, so we'll start with them now. Is it true that some patients are no longer diabetic after their transplant?
So it can be true depending on the circumstance. So sometimes people can have high glucose levels, and then the glucose, and it's related to something like the inflammation or the medication that they're being prescribed. And so then if those medications get reduced or discontinued, then their blood glucose levels can always go back to normal. I usually tell people, if that happens and their glucose goes back to normal, they may not need to take any diabetes medication anymore, and they may not need to check their blood glucose levels because everything has resolved. But it is important for them to remember that they had a reaction to whatever treatment that they had in the past that caused their glucose levels to go up, so that if they ever go on that medication again in the future, that they'll know that they are at risk of developing high glucose levels, and they can either monitor for it or tell their doctor so that they can put a precaution in place to stop the glucose levels from going high again.
Thank you. Next question. My non-fasting glucose typically exceeds 100, but my A1C level is usually in the low 5s. Do I need to be concerned?
So that is a question that would be kind of person dependent. So you would have to understand exactly why the A1C level is a little bit lower and the non-fasting glucose level is high. So, a non-fasting glucose of over 100 in theory can be normal, right? So it's the fasting glucose level of greater than 100 that we get concerned about. A non-fasting glucose level exceeding 100 could be a very normal level, and therefore an A1C in the 5s might be okay. In that situation, I think I would get a fasting blood glucose on somebody or do a glucose tolerance test just to check if the glucose levels do appear to be high. And then with the A1C, if for some reason the A1C didn't make sense, it could be a specific issue related to the stem cell transplant, like higher turnover of the red blood cells that's causing the A1C to be a little bit lower. So for me, I would investigate a little bit more, probably with the fasting glucose and maybe a glucose tolerance test if I thought that the glucose levels didn't match up with the A1C.
Thank you. This person wants to know if they put honey in their morning coffee, will that affect their blood glucose?
It can. So obviously there's some sugar in honey. So it can increase the blood glucose levels. If you're concerned about it, or if you think you have high glucose levels, and you think the honey is affecting it, one thing to do is check the blood glucose a day when you don't put honey in the tea, and then another day when you do, and then you can kind of see how much it has affected the blood glucose levels. It's not going to put everybody's blood glucose up, but if you have a tendency to high glucose, it can increase it a bit.
Thank you. She'll have to do a little taste test there. Does the glucose level or diabetes in the donor affect the recipient?
That's a very good question. So it shouldn't. It shouldn't affect the glucose levels in the recipients. It's usually the way the glucose levels are regulated or not directly by the stem cells. Usually it's you making insulin yourself, and then how much your body responds to the insulin that you make. So sometimes there's like inflammation and stress related to the stem cell transplant that can sometimes increase the levels, but it's usually not directly. It shouldn't be directly related to a stem cell transplant donor having high glucose levels. So it's an interesting question, but it shouldn't cause a problem.
Thank you. Next question is, this person tends to have high blood glucose, but it is always measured after they eat breakfast. So should this glucose be interpreted the same as if I was fasting?
No. So you can't, if you check the blood glucose after you eat, it's always going to be higher than if you're fasting. So it depends on how long after you eat that you measure your blood glucose levels, but everybody's glucose is going to increase within like an hour after they eat their breakfast in the morning. So that would be considered, if we're thinking of like diagnosing high glucose levels, that would be considered a random glucose if you're measuring it when you're not fasting. So if you wanted to know if the glucose level was high, you would need to do it first thing, like fasting after an 8-hour fast in the morning before you eat your breakfast.
Thank you. Next question. Do you have any statistics for post-CAR T therapy outcomes with diabetics?
Post-CAR T therapy outcomes with diabetes. Let me just think about that one for a second. Do I? I do not actually have outcome data post-CAR T with people with diabetes. I don't know that anybody actually has that data. It's also a very good question, though. It's you can get, I mean, CAR T, if you have what's called a cytokine response or an inflammatory response, it can actually increase glucose levels. And people who've been treated for multiple myeloma with steroids tend to have higher glucose levels sometimes. With multiple myeloma, there are studies that have looked at outcomes in people who have diabetes, but not specifically related to CAR T, but it's a very good question that we should look into.
We'll say more to come on that one.
Yeah, good research.
Does tacrolimus increase blood glucose?
Yes, it's not as much as typically the one that causes the glucose levels to go up mostly is the steroids, but tacrolimus can increase glucose levels a bit along with increasing lipid levels, and so it does contribute. It's usually not a severe hyperglycemia, but it can cause a mild increase in glucose levels.
Thank you. This person said for 10 years they have been maintaining pre-diabetes successfully via diet, and now they are finishing R-CHOP chemo for follicular lymphoma, and the glucose has spiked. They're now in CAR T therapy, and the blood glucose is higher. Have they lost their battle with diabetes?
No. So the CHOP, so this is probably like a typical situation a lot of people run into. So you can definitely maintain, I mean, it's a battle, but people can maintain their glucose in a pre-diabetes range for a number of years. Typically as people get older, they might have had pre-diabetes, and then as time goes on, whichever, either the glucose or the hemoglobin A1C creeps up, and people kind of transition into diabetes. But some people are able to maintain themselves in a pre-diabetes state for a number of years. With the R-CHOP, the thing is the prednisone and the R-CHOP, the dose of the prednisone, which is a type of steroid, tends to be high. And so if somebody has pre-diabetes and they go on this high dose of prednisone with R-CHOP, then their glucose can go up. The thing is, when the R-CHOP is finished, then and the prednisone gets tapered off, the glucose levels can come back down again. It can take some time, and it depends. Often with the steroids, the thing is that it depends on the duration somebody's been on steroids, because steroids have other side effects as well, like they can cause people to gain weight and eat more and things like that. So sometimes if somebody has pre-diabetes, the longer term effect of the steroids can make it harder for the glucose to come back down to normal again. And then with the CAR T, as I mentioned, there's not great data on CAR T and its effect on diabetes or the effect of diabetes on responses to CAR T, but it can cause an inflammatory response that can increase the glucose levels as well. So I would not say that this person has lost their battle with diabetes. I would say that they probably in the short term will need to kind of control it potentially with medication, and then as time goes on, I would follow up and see if we could taper off. You don't want the glucose to be uncontrolled, so you might potentially need medication in the short term, but then I would say follow up with, I would say a diabetes doctor, just because sometimes when people go on medication for diabetes, people are reluctant to taper it off again, but I would follow up then with somebody to see long term if those medications are still needed or if the glucose levels comes back down again.
Great, thank you for that. Next question is, they want to know about low glucose upon waking up in the morning.
Okay, so this can depends on the situation, I guess. So if somebody's on, so say somebody's on no medication and they wake up fasting in the morning and their blood sugar is low, sometimes it can be a normal thing. So it's surprising. It depends on somebody's age and many other things. But what keeps our blood glucose normal when we're fasting is essentially that our glucose puts out, our liver puts out some glucose that it's storing to keep the blood glucose up, and also our kidneys, to a point, can control the glucose levels as well. So sometimes people who don't have diabetes can have low glucose levels if they have any issue with their liver or with their kidneys. Also, people who are quite thin can have surprisingly low glucose levels. So especially younger women can actually have surprisingly low glucose levels fasting in the morning, and it's actually a normal glucose level. So it really depends on if somebody's getting, if somebody has no symptoms and their glucose number is just low, then it often doesn't mean anything. The other thing is if somebody's in the hospital, we frequently get low fasting morning blood sugars, and that's just a technical thing related to the blood sample that gets drawn and how long it takes for it to get from the patient's bedside to the lab to be analyzed, and so sometimes the glucose levels can decrease while it's waiting to get transferred to the lab. If somebody has low glucose levels in the morning and they're actually on diabetes medication, then that actually is a different issue. So if somebody's waking up with low glucose levels in the morning and they're on a pill, for example, that makes them make more insulin, or if they're on insulin injections, then we get more concerned about the fasting blood glucose in the morning. And so in that situation, you would want to kind of reevaluate the medication that somebody's getting and see if they actually need to have their diabetes medications adjusted so they're not getting low fasting glucose levels in the morning. Sometimes people also, if they have the low glucose levels in the morning, they're afraid to take their diabetes pills, and so in that situation it can cause the glucose levels to go higher later in the day. So that one would be kind of situational, dependent on what the person's situation is, whether they have diabetes or not, or whether they're getting symptoms or not with the low glucose, and whether they're on diabetes or glucose lowering medication or not.
Thank you for that. And this looks like it's our last question. This person writes, after being treated with a lot of steroids, I'm nervous about getting diabetes. My cardiologist suggested I take in very low amounts of carbohydrates, less than 50 grams per day, with normal protein intake. Have you heard of this? Is the first part. His concern is not only elevated sugar levels, but the amount of insulin I might be producing, thus having insulin-resistant cells.
Okay, that's another interesting question. Okay, so then, so there is a lot of, it would be interesting to hear what Michelle Myers, the nutritionist, is going to comment on this. But so a low carbohydrate diet, less than 50 grams a day, falls into what we call ketogenic diets, and there's a lot out there on people using ketogenic diets for, if you look it up, there's online, even there's just a whole collection of people discussing this in the setting of cancers and weight loss and things like that. So a very low carbohydrate diet can sometimes, so it can control the glucose levels to a point, and it can reduce the amount of insulin that your body needs to make in order to control your glucose levels. So the theory behind it is that essentially by taking in the same calories, but by having them in fat and protein rather than the carbohydrates, it'll help to reduce the glucose levels. That is true. The main issue with ketogenic diets, there's a few. So one is when you take away the carbohydrates, which is often like fiber in your diet, then people can get gastrointestinal side effects, most commonly like constipation. It's also very hard for people to maintain, at least in my experience, hard for people to maintain ketogenic diets for longer than a couple of months at best. I would maybe say 3 months, and this is just anecdotal, that if it's a massive change to your typical diet and routine, people don't tend to be able to sustain it for a very long period of time. So with the amount of insulin that you might be producing, that's a little bit kind of more complicated. So it's true that if you reduce the carbohydrate levels, that basically you reduce the amount of insulin that you need to make, and you can measure that in a blood test if somebody wanted to, and you can see that somebody can be less insulin resistant. My concern with it is, as I said, that I find it's not a long-term solution to anything, and so in that situation, I would tend to have people meet with our nutritionist and kind of evaluate exactly what is typical for you to eat and what's your typical diet, because everybody has kind of slightly different, depending on where they're from, a normal diet for them can be quite different. And so if it's, and then usually our nutritionist will work with somebody to kind of come up with a meal plan that makes sense. And sometimes it's just a case of reshaping, replacing one item like a snack or something with something else. And so, yeah, so you can do things like that. I tend not to recommend those very low carbohydrate diets for practical reasons, as I said. Plus, it depends on what you're trying to achieve. If somebody's lost a lot of weight, then sometimes I'll recommend replacing certain carbohydrates with healthy fats if their blood glucose is high. But I think long term, it's more important to kind of have something that's going to be a sustainable diet long term for an individual rather than something that's going to be a short term, very restricted diet that's going to be very hard to maintain.
Thank you for that. So that was our last question. So on behalf of BMT InfoNet and our partners, I'd like to thank Dr. Gallagher for a very helpful presentation, and thank you, the audience, for your excellent questions. Please enjoy the rest of the symposium.